Welcome to this month's Nutrition Pearl, Introduction to Pediatric Patients with Intestinal Failure, presented by the Council for Pediatric Nutrition Professionals. My name is Anna Tuttle, and I will be giving this introduction today. So, in order to understand intestinal failure and short bowel syndrome, we need to understand the definitions a little bit better. Short bowel syndrome results from intestinal resection. The definition of how much is resected can vary, but usually it's about 10 to 25% of loss of bowel length expected for age. And just to better understand this, we need to know that normal small intestine length for full-term infant is around 250 centimeters and large intestine is around 40 centimeters. And that the length of the jejunum, ileum, and colon actually doubles in the last trimester of pregnancy. And this short bowel syndrome can lead to diarrhea, malabsorption, fluid and electrolyte imbalances, and malnutrition. Intestinal failure is the loss of intestinal length or function of the intestine for adequate absorption of fluids and nutrients. And these patients often require parenteral nutrition due to their inability to grow and thrive on enteral nutrition alone. It's good to understand that these terms should not be used interchangeably. Sometimes they can go together. A patient with short bowel syndrome may have intestinal failure as well, but they can actually be used apart. And a patient may have all of their intestinal length or the majority, but still have loss of function of their intestines. There are various diagnoses leading to short bowel syndrome and intestinal failure. Here are some of the most common ones in the pediatric population. Necrotizing enterocolitis. The true etiology is unknown, but prematurity is the most consistent risk. And the classical presentation is in a young premature infant who has feeding intolerance, abdominal distension, and bloody stools after enteral feeds are started. Gastroschisis is a birth defect of the abdominal wall when the baby's intestines are found outside of their body, exiting through a hole beside the belly button. And because the intestines are not covered in a protective sac, they are exposed to amniotic fluid where they can then become irritated and causing them to shorten, twist, or swell. Jejunal atresia is a birth defect in a newborn characterized by partial or complete absence of the mesentery connecting the small intestines to the abdominal wall. And this causes a portion of the small intestines, the jejunum, to twist around an artery that supplies blood to the colon, and this leads to an intestinal blockage or atresia. Hirschsprung's disease, the long segment Hirschsprung's disease, or pseudo-obstruction can lead to inability to move food and or stool. Hirschsprung's disease is also a birth defect, and it's characterized by the absence of ganglion cells in a segment of the bowel, and this causes muscles in the bowels to lose their ability to move stool through the intestines. Pseudo-obstruction is when intestinal nerve or muscle problems prevent food and fluid from moving through the stomach and intestines. Regarding nutrition for short bowel syndrome, parenteral nutrition is needed, especially at the beginning to help meet calorie and protein needs before the gut can be used. But enteral nutrition should really be initiated as soon as medically possible to aid in intestinal adaptation. Different institutions may have different guidelines as far as advancing enteral nutrition. This is usually based on how early the patient was, how small they are, and how much intestines were resected. But it's really a patient-by-patient basis as far as the enteral nutrition advancement. The goal is always to increase enteral nutrition and decrease or possibly discontinue parenteral nutrition as well. Intestinal adaptation is vital for getting a patient off of parenteral nutrition. These are functional and morphological changes that can occur in the remaining intestines, and this occurs through mucosal hyperplasia, villus lengthening, increased crypt depth, and bowel dilation, and this will help with more absorption of the nutrients from enteral nutrition. So weaning patients with short bowel syndrome or intestinal failure off PN is dependent on the adaptation of the remaining intestines. In summary, intestinal failure can occur without short bowel syndrome, for example, with patients with gastroschisis. So that's something to keep in mind, that those terms are not always interchangeable. And different congenital conditions can lead to short bowel syndrome and intestinal failure. Enteral nutrition is vital in order to achieve intestinal adaptation, so that really should be started as soon as medically possible with these patients. Thank you for your time, and if you have any questions, please reach out to me at the email address provided.